Now we come to hepatitis C virus. Unlike hepatitis B virus, the immunology of hepatitis C virus is actually not available and not very discrete. That's the problem. So there is actually no test to finally understand the current ongoing hepatitis C infection unless of course hepatitis C virus RNA particles can be found out. Now let me take you through the course of this disease. As far as etiology is concerned, it's right there in front of you. It is hepatitis C virus which causes this disease. It is spread through mostly through IV drug abuse in developed countries. In countries like India, again the secretions, they are responsible for for transmitting. That means it's basically a blood-borne infection or a serum-borne infection. Once the patient is infected with this hepatitis C virus, for months together, the patient can stay asymptomatic. So the first to develop is anti-HCV antibodies. That means I'm talking not about this is the core antigen antibody. No, not that. Anti-HCV, when we write this test down, we write like this: anti-HCV antibodies. That means everything over here is in capital, and we write HCV, not unlike antigen over there. So anti-HCV antibodies, they develop and they remain almost throughout the life. So, and the titer also doesn't change. Even IgM for that matter, acute and chronic infection, the titer doesn't change much. So if you want to really find out whether the patient has been infected right now or is a chronic carrier, is a chronic infected patient, there is no way to actually find out until and unless you know that this patient was earlier IgM negative and now it is IgM positive. That means he is currently having the infection. Otherwise, it's very difficult to find out whether acute infection is going on or is this patient a chronic carrier. We do not know anything about it. So serology is not very discrete in case of the HCV infection. So how do you diagnose it? You diagnose it, of course, through these antibodies, because now they are universal screening program. They should be incorporated. They have been incorporated. We've been writing down for all our patients. Like we write HIV, we write anti-HBS, we write HBS antigen. Now we write down anti-HCV antibodies also to find out whether the patient is infected with this virus or not, because chronic carrier state of HCV virus is highly linked with cirrhosis, liver failure, acute and chronic infections, and a lot of morbidity, mortality. Plus, it's very difficult to understand this infection. Not much is known and nothing is very discrete. So follow-up is also very, very important of this patient. So once these antibodies come out to be positive, what is your second step? You find out the HCV RNA load, and from there, you will have to make up a team with gastroenterologist or hepatologist, and you will have to continue with the management as a team, because they obviously know better than you, unlike in case of hepatitis B virus, where we knew a lot about the virus and we kind of know how to manage as well. But this, what course will it take during the pregnancy, because it's an immunocompromised state? Yes, the vertical transmission is known from the parent to the newborn, but breastfeeding, coughing, sneezing, touching, these things should not be avoided, because in case of newborns, when a newborn is born to a patient who is already infected with HCV virus, there are relatives who abandon all these things. So these things have to be counseled at the time of delivery. As far as delivery is concerned, the patient should not be forced to have a C-section, though the transmission rate is somewhat lower with C-section as compared to the vaginal delivery. But yes, the patient should be counseled accordingly. So as far as management is concerned, the management has to be supportive like in all other viral diseases. So again, HCV, like I said, unlike HBV, is little less known and less to understand over there, because not much things about it are black and white. It's one thing which you should know about it is that despite the fact that it's an infection, you do not get to know whether it's an acute disease or a chronic disease, which is the most important and a handicapping factor, because if it's an acute infection, there is a different set of management. If it's a chronic infection, you tend to take it as one of those diseases like hypertension or diabetes, which are ongoing, just supportive management. But if it's an acute infection, it can derail anytime, so you should know that as well. Anyways, when it comes to hepatitis D virus, we should know that hepatitis D virus is an incomplete virus. It usually is associated only with hepatitis B virus co-infection. It is called also piggy tail infection, because it needs hepatitis B virus to co-infect in the body. It does not work on its own. It's an incomplete virus. So any patient who is suffering with HBV hepatitis B virus, you should also get done a profile of, and over here, hepatitis D virus, you go in for a PCR. There is no antibody test for hepatitis D virus, you should know that. So if any patient is HBs antigen positive, if you want to see a co-infection, whether it is there or not with hepatitis D virus, you should go for a HDV PCR, HDV RNA PCR. And the last segment now, we'll be discussing about hepatitis E virus.